Welcome to the Thames Valley Cancer Alliance Health and Wellbeing series. Our sessions are developed and delivered by health and wellbeing professionals from hospitals and other healthcare providers working in cancer services across Berkshire, Buckinghamshire, Oxfordshire and Swindon. Today I'm joined by Sam Glover, occupational therapist from Oxford University Hospitals, and Sam will be talking today about depression and cancer. She'll talk about the symptoms of depression and how they differ from psychological distress, and also she'll describe how much more common depression is if you have a cancer diagnosis and how that depression often goes undiagnosed. Sam, thanks for being here today. Give us a little introduction of who you are and what you do in your role.
Hi there, my name's Sam Glover. I'm an occupational therapist in the psychological medicine team at the Cancer Centre at Oxford University Hospitals NHS Foundation Trust. And I work here with a team of doctors and nurses. And our main role here really is to assess and treat our patients for depression.
Can we start by describing the symptoms of depression? We hear the word quite often, but sometimes it's difficult to know what the features of depression are as opposed to the distress people might be feeling as a result of their diagnosis.
So it's really important to be clear about what we're talking about when we say depression. So a lot of you will go through psychological distress at some point during your cancer journey. So, you know, whether that's when you're first told about the diagnosis, halfway through treatment, or, you know, when you're coming to the end and you're about to be discharged. So that it's very rare that you won't have some kind of psychological distress, and that's completely normal. You know, an adjustment reaction to what you've been told or scan results, you know, that's very, very normal. But when we talk about depression, we're actually talking about an illness in itself, which, as I said, has a huge impact on you know, your ability to sort of be resilient with your cancer treatment as well as function on a day-to-day level. So the two key kind of major symptoms of depression are really a persistent and pervasive low mood. So that's kind of the first thing that we would look out for. You know, so feeling low more of the time than not, you know, that feeling that's there every day, doesn't really shift, you know, has a huge impact on your daily activities. You don't really enjoy things as much as you used to, even if that's watching telly or, you know, seeing your friends. That motivation to sort of even get out of your pajamas in the morning can be really, really difficult. So it really does have a huge effect on everything that you're trying to do each day. So the two core symptoms really are the low mood and the reduced interest in things that you used to enjoy. The other symptoms can be a bit tricky to assess sometimes if you have cancer, because you might be feeling a lot of these symptoms already. So fatigue, difficulty sleeping, a reduced appetite, all of these things are symptoms of depression, but can also present when you're having treatment or as as part of the disease itself. So they can be kind of the more physical side, so disturbed sleep, so waking up throughout the night a lot, or sleeping too much, so maybe sleeping long into the day, having to nap an awful lot, you know, feeling that bed is really your only safe place to go to and where you feel most comfortable. Another symptom, which again can present more physically, is a physical kind of agitation. So feeling very restless, feeling very fidgety. You sit down, but then you have to get up again. You might go from room to room, not really know what you're doing. So it can kind of come out as a physical agitation, but also in terms of a mental agitation. So not being able to sort of concentrate on things. Your attention might be flitting from one thing to another because you're worried about things and things are on your mind. And the opposite to that is also feeling much more slowed down. And again, this can be difficult to pull apart when you have cancer, because a lot of the time you might feel very lethargic and very slowed and, you know, not up to your normal speed. But actually that can also be a symptom of depression. And again, that goes through to the mental feeling slowed down as well. So not feeling that you can process things as well as you normally would, rereading the same paragraph of a book, talking to people on the phone, but kind of losing your concentration and your flow. So a lot of those things, again, can be caused by cancer or cancer treatment, but again, can be caused by depression as well. And then another key symptom that we kind of look at really is that feeling of not feeling very good about yourself. So feeling very worthless, feeling like a failure or a burden. And again, you know, if you have cancer and you have to rely on your family to do things for you that you might not have had to previously rely on them for, that can be very difficult for people to understand. You know, you've been a very independent person before, you've driven yourself everywhere, done your shopping, all that sort of stuff, and then all of a sudden you're having to ask for help, and particularly with you know, younger patients, that can be very, very difficult to ask for help in that way. And then unfortunately, if depression goes on for too long without treatment, sometimes it can lead to more suicidal thoughts and feelings, which are very, very difficult to handle. And they also, you know, when you're going through treatment that's trying to save your life, you know, but you're feeling very depressed and that you want to end your life, it really does create that very difficult place to be, which is why it's really, really important that we treat depression at the earliest stages, really, so that we avoid getting to that stage. And I think the other thing to mention, adjusting to things, to the news you're being told by your doctor and your nurses, you know, that's very different. That doesn't mean that you're depressed, because it's completely normal to hear bad news and spend a week, 2 weeks feeling very low and very sad about that, or very anxious and very worried. And I think, you know, people have coping strategies. You'll have your family, your friends, things that you can turn to that will help you get through that. But if it gets to a point after, you know, about a month where you're thinking, actually things aren't really shifting for me, I'm still feeling very, very low, I'm still not wanting to go out, see people, you know, it's really worth reaching out for some help at that point, to get a bit more professional help.
Sam, thanks for that. It's really comprehensive description. And I know you're keen for people to understand how much more common depression is for people with a cancer diagnosis. Can you talk a little bit about that and the impact depression can have alongside living with cancer?
Major depression affects almost 10% of patients with cancer versus 5% of the normal population. So it has a significant effect on your quality of life, you know, your day-to-day functioning, going to work, your relationships, financial impact. It really is across the board. So it's very, very important that we treat depression as thoroughly as we treat the cancer itself for you. And the other thing to kind of mention is that if you have been through cancer and you've had some kind of psychological distress, or indeed a diagnosis of depression, you're much more likely to still be experiencing some component of that up to 10 years on from the time you might finish your treatment. So again, that it shows the longevity of depression and cancer. It's not just something that might disappear once you're discharged from oncology. It's something that stays with people for a long time.
Of that number, so the 10% who do have depression alongside their cancer diagnosis, can you give us an idea of how many are receiving treatment and what kind of treatment that might be?
Nearly 75% of people who have cancer and are depressed aren't receiving any treatment at all. And that's quite a stark, you know, statistic in itself. And then if we look at the other sort of subgroups of that, so, you know, 22% are taking an antidepressant, but it's really, really kind of the, you know, 2 to 3% are seeing a mental health professional as well. So I think that really highlights that the usual care that people receive from their GP, you know, you might go to your doctor and you might get prescribed antidepressants, which is an evidence-based treatment in itself. But actually what we've found is that the gold standard, if you are depressed, is to have a talking therapy, you know, alongside an antidepressant, and to monitor that very closely to receive the best results.
The research shows that depression is common for many, if not all, cancer types. Can you talk a little bit about that and describe some of the reasons why the depression might occur at any point in someone's cancer journey?
What this slide really illustrates is the prevalence of depression in patients with cancer. So it highlights a few different types of cancer, from lung cancer to breast cancer, and really shows statistically that it's very common to experience depression when you're going through cancer, whatever stage of the pathway that is, when you're first diagnosed, throughout treatment. Most commonly, you might also feel very depressed when it comes to an end, and I think it's very difficult if you feel that way, because there should be this kind of elation that sometimes your family might feel, that it's all over, you don't have to go to the appointments anymore, but actually you might feel not actually that happy about it. You've gone through a significant amount of time with support from healthcare professionals, having a structure of your treatment, being sort of on this almost conveyor belt of being told what to do. And while that can be very difficult, when that's removed, it can feel very scary to sort of go back into the world by yourself again, have to go back to work, have to return to normal. That can be really, really challenging. And I think that leads into why 10 years after, treatment has finished, people still report feeling very low in their mood, because they haven't really processed, what they've been through. It's kind of been a very short pathway sometimes, particularly with cancer like breast cancer. The treatment's so effective now, which is wonderful, and it's so quick that actually that doesn't really give us time to catch up psychologically with what we've been through. And if that isn't addressed at the right stage, it can lead on to more kind of long-term problems sometimes. So it's really a case of prevention and looking at the longevity of your mood. So making sure that you're aware of it along the way and you ask for help as much as you can. And that afterwards you don't think, okay, just because I'm not under the cancer service anymore, I'm not allowed to ask for help. There isn't things in place, because there is. And it's just about finding out what's local to you and what would be available.
And why is it so important to acknowledge and bring attention to our mental health alongside a cancer diagnosis?
Our bodies aren't separated into mental health over here, physical health over there. We're very much intrinsic, we're integrated. And if one thing affects our physical health, our mood is going to be affected, and vice versa. So it's really important that, when you have cancer, you don't sort of put pressure on yourself to feel absolutely fine and feel positive all the time, because someone has been through it and they've coped really well. It's really about sort of giving yourself permission to have those down days, which are completely normal. And there's a lot of reassurance in that sometimes, that it's okay to feel this way and to have days where you're going to cry or days when you're going to laugh, and every feeling that you have is completely valid. There's no right or wrong way to feel when you're going through cancer. And I think by being more holistic as healthcare professionals as well, we're really trying to kind of remove the stigma that's still attached very much so to depression. People feeling happy to talk to their doctor about their pain or about feeling sick, but actually when they get asked about their mood, sometimes it can feel very difficult to talk to doctors and nurses about that, because you feel you should just be coping, and you're so grateful someone else is much worse off than you, and whilst all of those feelings are completely understandable, it's not actually helpful for you to feel that way, because you're an individual, you have your own needs and your own feelings, and like I said, there's no right or wrong way to feel. It's about supporting our patients really in a very holistic, individualized way.
And we focused today on depression as a result of cancer in this video, but it's important to remember that some people receiving a cancer diagnosis may already have a diagnosed mental health condition. So how might cancer affect people with a current or previous condition?
If you do have previous mental health problems, whether that's depression, anxiety, previous trauma that you might have been in, cancer can sometimes act as a catalyst for making those feelings sort of resurface and reappear. So, again, you might already have things in place. You might have support from a mental health team or from your GP, but it's very important just to stay very aware of how your mood is during, your cancer treatment, because if it does start to veer off for any reason, it in itself is a traumatic event, having a cancer diagnosis. And I think we have to remember that when someone comes in as an inpatient, if they need surgery, or just coming every week for chemotherapy or radiotherapy. It's very, very traumatic. I mean, even from sorting out the car park to, you know, find out where they need to be, you know, the appointments times, if that's moved for any reason, all of these things are very, very stressful. And actually, if you put it all together just for one day, you know, the travel to the hospital, it can really be very, very traumatic. And actually, again, it's not until you reflect back on it that you realise how difficult it was. And, you know, you need a lot of resilience really to be able to deal with that. So sometimes if you know, you have been depressed before, you're on antidepressants, you're having therapy, it's just sort of, again, giving yourself permission to say, actually, this is a really tough time for me, and I need to use the strategies I've learned over the years to help me cope with this.
And finally, Sam, is there a take-home message from you to our viewers today?
I just really want to say thank you to everyone who's watched this and listened to the talk. And I suppose as a takeaway message, it really is just to say that you don't need to suffer in silence. You know, there's a lot of effective treatments for depression, but also if you're psychologically distressed, there are a lot of amazing support services like Macmillan that can help. So don't feel that just because you have cancer, part and parcel of that is being depressed or feeling low in your mood, because although it does very much go alongside it sometimes, it doesn't mean that you just have to put up with it. There's a lot of good support and treatment out there. So it's really important to give yourself permission to feel that and to ask for help in the best way that you can. So thank you very much.
Thank you very much, Sam. We really appreciate your time. Thank you. And thank you for watching. We really hope you found Sam's video useful today. Please leave some feedback in the comments. We'd love to hear your thoughts on this talk and on subjects you'd like us to bring you. To find out more about the Thames Valley Cancer Alliance, please visit our website. Details are in the description for this video. You can join our mailing list and also find information on how you can get involved with the work that we do. Thank you again, and we look forward to bringing you more of the information you want to see.